everybody, it's Dr. Glockenflecken.
And Lady Glockenflecken.
Guess what? We are bringing our live show, Wife and Death, to Lebanon, New Hampshire, September 15th at 7:30 p.m.
That's right. Back to the Upper Valley at the Lebanon Opera House.
So I went to med school at Dartmouth.
Yep, I went to grad school there.
And we wanted to come back and put on a show for the community. We cannot wait. It's going to be a blast. You can find tickets at our website, glockenflecken.com/speaking, or go to LebanonOperaHouse.org. We'll see you in September.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock Eye with me, your host, Dr. Glockenflecken, your one-stop shop for all things eyeball related. I am coming to you from my second night on call. I'm not going to jinx anything. I'm not going to even tell you how it's going right now. It's fine. It's going just fine. But will it continue to be just fine? I don't know. We will see. I am recording this on July 2nd. So by the time you hear this, I will have just finished call. And so I have energy. I'm a bit caffeinated. I'm ready to go. But I'm also, I'm a little bit scared about what will come. And it's not so much 4th of July. That alone can be challenging, but I don't take call at a level 1 trauma center. So whenever you're talking about explosion injuries, like holding onto a firework or gazing into a firework shooter that isn't going off and blowing your face up, those are typically high acuity traumas, like life-threatening, quality of life threatening, whatever you want to call it, like severe deformity type of injuries. I'm not sure how you characterize like a blown up hands, but they typically go to like the highest level, which is a level 1 trauma center. Big bad injuries go there. I am taking call at further out community hospitals. I work at outside hospital. That's what you would call it. And so level 2 trauma centers, meaning they take care of like most other things, but big, heavy traumas typically have to go up to the university, or we have a couple level 1 trauma centers in the Portland area. So ever since residency, I don't deal with a lot of those major injuries. We might have some of those, but what makes this call week particularly difficult is because it's just a long weekend. So Friday, Saturday, Sunday, there's nobody at all of our practice locations. So I'm covering all of our patients as well as all those hospitals. They have no one to send patients to. Because if something comes in on a Friday, during the day and we have clinics open, like I as the on-call doctor don't have to see everybody. But now this Friday, all of our clinics are closed. All right. Long holiday weekend. So it all is on me for 3 consecutive days. And yeah, I know it sounds like I'm just whining, and I am. Let me whine. I'm entitled. All right. I will do it. I'm going to do the work, but I can complain about it. That's okay. No one likes taking call, but I understand that I have no perspective, that I'm a private practice ophthalmologist. I get all that. All right. But I can complain a little bit. That's okay. That's why I would never complain to a resident who's taking general surgery call. Like, come on. I haven't lost that much perspective. I know there's levels to this call thing. So anyway, but I'm doing okay now. I'll fill you in next week on how the call week goes. So, what I want to talk about today, and probably a shorter episode, I'm guessing here. First, I'm going to talk about negotiating with UnitedHealthcare. Not really just UnitedHealthcare. This could go for like any payer, any big health insurance company. Whether it's Aetna, Blue Cross, Cigna, whoever, any of the big 4, really. For some reason, it comes up a lot with United. So we're going to talk about that because my practice is currently in that situation. And then I'm going to give a little bit of life advice for all the brand new residents and out there, residents, fellows, people in training, starting training, just a few little tips, little things that can help get you through the next 3 to 11 years, depending on how much of a neurosurgeon you want to be. All right. So first, UnitedHealthcare. Okay. So when you one of the most challenging things when you're running a private practice is your insurance rates. If you opt into Medicare and insurance and all these things, well, that's where the patients are. So they have the insurance companies, they can control the flow of patients. They really try to do this. They try to dictate terms with your practice in terms of how much you're going to get reimbursed for the services you provide, just because of how many patients they have captured. All right. How many patients pay premiums to UnitedHealthcare? Right. So if UnitedHealthcare has, in the Portland area, they have, 100,000 patients. All right. They can tell all those 100,000 patients, oh, well, you know what? We're not going to let you go to see Glockenflecken's practice anymore. They could do that. All right. And so it's this constant back and forth between practices and payers about reimbursement rates. And for a little bit further context, Medicare reimbursement rates are always getting cut every year. They're going down. And insurance companies, they look at Medicare to determine how much they think they should pay doctors. So it's this back and forth, this push-pull. And for some reason, well, not for some reason, it's because of greed. UnitedHealthcare is consistently lower in the amount they reimburse compared to other commercial payers. They they increase their rates less than anybody else. They are just notorious for this. And so every couple of years, really every year, we're in this battle where we have to try to renegotiate with UnitedHealthcare. Now, one really important caveat here is that I am part of the largest private practice in this region, in the Portland metro area, which is a large area. So we have economies of scale. We have a large market share. And by the way, we're completely 100% physician owned. I practice what I preach here. I am all about independent practices, but I recognize I am fortunate to be in a really large practice. So in today's healthcare environment, you can really start throwing your weight around when you're large. I have heard from so many solo practitioners, not just in ophthalmology. Actually, there's very few in ophthalmology now, but in other specialties, in family practice, in internal medicine, and in primary care, that don't have the ability to fight and renegotiate rates to what they should be paid because they don't have size. They can't throw their weight around with a commercial payer because the commercial payer can be like, okay, well, all right, solo guy, we're just going to drop you. You're no longer in network for us. So our patients are going to go elsewhere. That happens all because that solo doctor realized, oh, wait, my costs have gone up about 15% over the last year, but UnitedHealthcare hasn't increased my rates in the last 5 years. So how am I going to keep the lights on if I'm seeing a lot of UnitedHealthcare patients? Hey, UnitedHealthcare, you think you could pay me a little bit extra? Like, oh, no, we're not. You're dropped. You can no longer see our patients. Because if patients come to see you, you will be out of network, which means we won't pay you. We won't allow, or we'll pass that money off to patients, and they have to pay more. And so patients will just not come to you anymore. So that is the reality for small practices. And so again, I'm fortunate to be in a large practice that we can throw our weight around. And so I want to tell you how we throw our weight around with someone who's notoriously difficult to deal with, which is UnitedHealthcare. What they'll do, well, they'll ask you to re-up the contract. So you have a contract with them, all right, that establishes reimbursement rates. They'll ask you to re-up with them. And if you say, "Oh, we would like to renegotiate," all right, you'll have probably radio silence for a while. And then eventually UnitedHealthcare will start to tell their members that the contract is running out with so-and-so's practice, with Glockenflecken's practice, and they have not signed a contract with us, and so they will no longer be in network as of August 18th, whatever it is. They will tell their members that. And that freaks out patients. Because like, who am I going to go to? Like, I can't see you after August 18th. What am I going to do? I'm supposed to do, I can't do surgery with you because, the surgery that I've scheduled is in September. Like I have to cancel. So it really freaks out patients because it's disruptive to them. And obviously we don't like that because our patients are confused. They don't know what to do. And so the most important thing you can do for yourself, if you're in this situation where you want to try to renegotiate a contract with someone like UnitedHealthcare, is inform your patients. Talk to them. All right. The way we do this is we set a phone message that explains exactly what's going on. Our contract is set to end with UnitedHealth on August 18th. We have asked for an increase in reimbursement by X percentage amount to adequately reflect our increased costs, or something like that. We'll also sometimes say UnitedHealthcare has increased premiums by 20 to 30%, but they have only proposed an increase in reimbursement rates of 1%, which is the truth, absolutely the truth. We tell that to patients. And then we'd say, if you, what would really help is if you would just tell UnitedHealthcare, call them, tell them that this isn't fair, that you need to pay what our doctors are worth. You need to come to an agreement and negotiate in good faith based on current rates elsewhere. UnitedHealthcare, their rates are consistently below other payers. We are fully transparent with patients because once patients see that, oh, wait, yeah, UnitedHealthcare, my premiums are 20% higher this year than last year, but they're not paying the doctors anymore for the services they provide us. When patients hear that, they think the natural conclusion is, well, where is the money going? Where is the money going? And the conclusion obviously is, well, I mean, it's going into their pockets, right? They're not using that increased premium, that it's not coming back to service their customers, to service the patients. And so every chance we get, we tell them that. So it starts with our phone message. We have that. Like, if you want to hear about something that's going on United, press 1, whatever. If you have a question about UnitedHealthcare, press whatever button. And so we inform them that way. As it gets closer to the date of when our contract ends with UnitedHealthcare, we'll send letters. And again explaining all of this whole situation. Because if there's one thing, UnitedHealthcare is a major for-profit company. All these are. So they need to keep their customers happy. And so when they start hearing from angry customers, it matters. It really does make a difference. When they know, whoa, we have heard from 300 people, all really upset that they don't get to keep their eye doctor because we're not negotiating in good faith. You have to not be afraid to stare them down. All right. A couple times we've let the contract run out. And that really makes people, once you get to the point, usually we can come to an agreement before the contract runs out. There's all this posturing. The letters are sent both ways. We'll send letters to our patients, and eventually, UnitedHealthcare blinks because they don't want to make their customers upset, and they know that all the customers are on our side. They're on our side because no one likes insurance companies right now. And obviously, we're in the right. They're in the wrong. by charging customers more, but not paying that money out where it needs to go. And usually it gets resolved with the rates that we think are fair. But sometimes you got to even go to the brinksmanship. You gotta go past the date. You got to let the contract run out, and then eventually they'll come to the table. Now, again, the big asterisk here is we are a large practice. We have the ability to throw our weight around. We have a large market share. You almost have to stay independent now. And so that gives us a lot of bargaining power that a 1, 2, 3 doc practice might not have, especially in a large metro area where there's lots of other options for doctors. And that brings me to another point I've been thinking about a lot lately. The way that my practice developed, this was now 30, 40 years ago, is it was 3 individual physician-owned practices, all competing with each other. They all decided to come together under one practice umbrella called iHealth Northwest. It's not a secret where I work. You can Google me and it comes up. And that was incredible foresight, because 40 years ago, we were in a very different practice environment. Private practice was still king. That was what you did. You just knew you're going to finish residency, go into practice, start your own practice, hang your shingle. All right. Now, 40 years later, it's like almost unheard of. Like, no one coming out of residency is thinking, I'm going to start my own practice. There are a few, obvious, some specialties can do that a little bit better, like psychiatrists. I mean, their overhead is so low. They just need an office, a couch, and a computer, and they're good to go. Like, I'm very jealous of the startup costs of a psychiatry private practice. That's not the reality for most people. And so it's not generally even considered for new residency graduates or fellowship graduates to just start their own practice. They'll often join other larger practices or become employed. And so iHealth Northwest, when we started, we combined 3 practices into one big practice. And it was, I'm not sure what they were thinking initially whenever they made that decision, but it has benefited all of us that have come after, because we have that size and we have been able to avoid private equity and stay independent. And that's been good for our patients. We take great care of patients. I am a bit biased, but we do. And we have no trouble hiring people, because new graduates, they want to be independent. They like the idea of being not being private equity owned, which there's a lot of in ophthalmology. And now we have good bargaining power. So the point is, I think other practices should consider that model if you haven't already. Talk to other practices in your community. If you have any other physician, if there are any more out there, join forces. All right. But stay local. I'm not talking about like starting up the next Sound Physicians, where you go and you grab as much private equity money as you can, be partially owned by UnitedHealthcare, Optum, and start just taking over, the rest of the country. I think it's really important that you don't try to grow too quickly, and you stay local. You stay true to your community. You be there for your community. You take good care of patients. You create a reputation. That takes time. My practice has been around for 40 years. I've only been around for 9 of those years. And but join forces in your community. All right. Support each other. That's the way that one way we can try to save independent practice. But it certainly helps with negotiating rates. And our rates with UnitedHealthcare are higher than most in the country, because we're and I actually, I wish I could take all the credit. I don't take any credit, really. We have an unbelievable admin team that is very willing to look them in the eye and tell them what we need, and then take them to the brink if they don't give it. All right, so let's take a break, and we'll come back. I got some advice. Hey, Kristen, it's hot outside.
It is a summer.
You know what that means?
What?
T-shirt season.
That's right.
I love a good T-shirt. You know who makes a good one?
Who?
Cozy Earth.
They do.
They're all-day tees.
Yes.
They're soft. They're comfortable, but they're also cool.
Yeah, and the rib knit pajamas, I really like those because they have like a good weight to them, but they're still like cool and breathable.
And Cozy Earth stands behind everything they make, a lifetime warranty and 30 days of hassle-free returns if anything isn't quite right.
Nothing to lose.
This summer, Cozy Earth's all-day tee and rib knit pajama set are the two things I keep reaching for. Made from viscose from bamboo, breathable, soft, and built for the season you're actually living in. Summer lives here, and honestly, so does cooling comfort. Head to CozyEarth.com and use my code KNOCK for an exclusive 20% off. Again, that's code KNOCK for 20% off. And if you see a post-purchase survey, mention that you heard about Cozy Earth right here on Knock Knock Hi. Hey, Kristen, remember how you love eyelid mites now?
Sure.
Well, there's a lot of confusion out there. I want to clear something up.
Okay.
All right. People think they can get eyelid mites from dogs and cats.
Can they?
No. These particular Demodex mites are specific to humans.
Okay.
So spread from dogs and cats is not expected. That's
So
a myth.
Can't get them from cuddling our poodle.
No. Demodex mites that cause blepharitis live on humans. Most adults already have them. They just usually don't cause problems. It's when they overgrow that they can lead to itchy, red, irritated eyelids. Those little collarettes.
The crusties at the base of the eyelashes.
Right.
And the good news is there's a prescription eye drop available for Demodex blepharitis.
That is great news. To learn more about eyelid health and Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, real quick, I haven't done this in a while. The don't do that eyeball tip of the week. I just mentioned it. Don't look into a firework launcher wondering why it's not going off. You don't want that thing blowing up in your face. All right, please don't do that. All right. So we are past July 1st. That means all the new residents have started and new interns, and they are overwhelmed and learning. They put their face in the fire hydrant. It's just they're learning more than they have ever learned at a rate that they've never learned that they've never experienced before, and they're doing an amazing job. And they're having great oversight by their attendings. All of that's happening. It's teamwork when you bring in new residents there who are incredibly brilliant, incredibly hardworking. They're putting in 70-hour weeks. They are really. Probably even more. I'm probably underestimating that. So I have a few tips, really more like life advice for anybody who's starting residency program this month. So our first advice is please check vision before consulting ophthalmology. This is probably the most important thing that you can possibly learn in residency. I don't care what residency program that you're in, what specialty you're doing. It just keep that in mind. Like, never forget, lock that forever in your hippocampus. Leave it there and come back to it whenever you get a patient with eye problems. All right. Just check a vision. Doesn't take long. It's not that hard. All right. Okay. Be humble. You don't know everything. I think most med school graduates are aware of this, like, because we've seen from a med school perspective of rotating hospitals, how challenging this is, but you don't really understand how difficult it is to like be in practice and making the decisions and writing orders and managing a list of patients until you're actually doing it. And so realize you got a lot to learn, and you got a lot to learn from everybody. You got a lot to learn from attendings. You could learn a thing or two from physical therapists, from dietitians, from the nurses who are taking care of the patients. So you can learn from a lot of different people, learn from each other, learn from everybody. Just learn, and don't discount anybody's expertise. All right. Just like you shouldn't let other people discount your expertise. Stand up for yourself. Stand up for your clinical decisions. That doesn't mean be rude. That doesn't mean blow people off when they offer advice or they have suggestions. You listen you think about it and you judge that advice or that recommendation according to what you know and what your expertise is, and you come to a decision. All right. So it's just about listening, just about listening and weighing your options. But all that, you can't do any of that unless you're humble and realize that you don't know everything and you got a lot to learn. Be kind. Uh, Such a simple thing, right? Just you're going to have times where you feel so annoyed, you feel angry, you feel like you want to destroy the world or the world wants to destroy you and you're mad about it. But don't let that bleed over into your professional interactions with people, even though it's hard. We all get a little crabby. All right. That's okay. Still be respectful and try to be kind and understanding with others. Easier said than done, but just if you need to just take a beat and be by yourself for a bit, collect your thoughts. All right. Do some breathing exercises, do a little minute meditation, and then go back to your interaction with somebody. Whatever you got to do to just be level-headed and calm. It's going to make you a better a better coworker, a better colleague, a better doctor, if you can stay calm. Um, Listen to patients. We receive great education and training on that front. When we come out of med school, we are so good at listening to patients. We're so good at taking a history, but then that gets beaten out of us. So try not to let that get beaten out of you. All right. So it takes being proactive. The more patients you see, the more busy you get, the less you're going to want to sit there and talk with a patient. But sometimes it just takes thinking about, okay, this patient clearly they need someone to talk to right now. They need someone to listen to them. And you can be that person, all right, because you know how to do it. You're trained how to do it. And try not to let the pressures of the healthcare system eat away at that. Turn off your brain from time to time. So I still do this. I have things in my life that allow me to stop thinking about medicine and healthcare. And it is a great way. I play ultimate frisbee, and playing ultimate, that's something I can do for 2 hours and just, do not once think about me- healthcare, medicine, creating content, private equity, all these things that piss me off, ophthalmology. That doesn't piss me off. I love ophthalmology. Anyway, have something in your life that allows you to do that. It can be anything. It could be like walking around your neighborhood. It can be listening to music. It could be dancing alone in your bedroom. Even if it's when you're a resident, yeah, I know you feel like you don't have time for hobbies. Take 5 minutes a week. You have to do this. This is not a suggestion. No, this is a requirement at Glock and Flecken School of Medicine. You have to do something that allows you to not think about medicine. I don't care if it's 5 minutes a week or 5 hours a week. Figure it out. Do it. Everybody has something they love doing outside of medicine that just keeps you sane. That you just it's a joy to do that thing. Cooking, I don't whatever. Do it. Keep doing it. I don't care if you're a resident. I don't care if you're a neurosurgery intern. You have to do it. Just do it. And you can tell your attending, I made you do it. Say, I actually have to go home right now. Dr. Glockenplecken told me I have to crochet something tonight. I'll take the blame. Tell them, contact me. Send me an email. I'll tell them what's what. All right. That this is important for your mental health, for you to be able to sustain this crazy career in medicine that you have. That's all. That's my advice. I don't know. I don't have a lot of advice, I would say. I mean, I have some, I have some good things, some things I've learned. And just, treat each other nicely. That's such a big one, especially co-residents, man. They are in this with you. And there's going to be very few people in your life in residency that truly understand what it is you're going through. And that includes your attendings. They may have maybe had a very different experience. Maybe they went to maybe a different program under different leadership, under a different healthcare system. And so they may not understand what you're going through, but you know who does understand what you were going through is the people right next to you, your co-interns, your co-residents. So lean on those relationships, foster those relationships, be kind to them, support them, do things for them. Someone gets sick or a family member dies or has an accident or whatever, any of the 1,000 things that can happen in life that are not medicine career related, you be the one to support that person. Just offer to take call. Hey, what do you need? You need me to cover your shift? I'll do it. Absolutely. Because you know what? What goes around comes around. It really does. And you're not doing it because you're like, oh, maybe if I do this for them, they're going to help me later. I mean, yeah, that probably will happen. But you're just doing it because this is a fellow human in a difficult spot, and you want to be the person who helps. And you're a team. All right, your co-residents, got to be there for them. Because for a few years, no one else will be at the hospital, at work. And so be that support. It's like putting money in the bank. That's what you're doing. And the bank of humanity. and you're just adding humanity to an inhumane world. And that's it. I wish you all the best of luck. It's going to be hard work, but it's so rewarding. I look very fondly on my time in residency. I had a tough residency program, very busy ophthalmology department at Iowa. But I loved it. There are parts I didn't like so much, but when I look back on it, I cherish and value those relationships that I made with people. That's what I remember the most. The interactions with with people. I remember a few patients here and there, but mostly the people I worked with. And so you want that to be a positive in your life. That's going to help you get through it. But you're all going to do awesome, and good luck in whatever you are pursuing in life. That's it for Knock Knock I. I'm your host, Dr. Glaucom Flecken. Thanks to my executive producers, Aaron Corney, Rob Goldman, and Shanti Bricka. Editor and engineers, Jason Portizo. Our music is by Omer Benzvi. Knock Knock I is a human content production. I'll see you next week.
Knock, knock, goodbye.
We are very excited to tell you about a healthcare news podcast that just came out. It's called Medlines.
See what we did there? Medlines, headlines.
That's good. That's good, right? It's a weekly wrap-up of everything in our field, from breakthrough discoveries to research, politics, pop culture.
Yeah, I think the best way to think of it is kind of like NPR's Up First podcast, but for all things healthcare.
And we're excited to be a part of the team behind it, along with our partners at Human Content and our inaugural sponsor, the New England Journal of Medicine.
Yeah, we wanted there to be a podcast out there for busy healthcare professionals to stay informed on the go without taking a big chunk out of your day.
It's the episode's like 15 minutes.
Yeah, or less.
That's like the length of a cataract surgery.
Exactly.
Episodes of Medlines are out now wherever you get your podcasts, with new episodes out every Friday. Check it out. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts, or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.